All right, so we're here with Dr. Amiel Moshfegh. He's a vascular and interventional radiologist in LA, and he's going to speak with us about sphenopalatine ganglion nerve block and its use for migraines. How are you today?
I'm great. How are you?
Very good, thanks. So to get started, can you describe what a sphenopalatine ganglion nerve block is?
So this is hard to explain, but ganglion is a collection of nerve cells that helps regulate certain functions in your body. The sphenopalatine ganglion is located in the back of the nose, and it plays a role in many types of headaches. Headache treatment by application of medication to the sphenopalatine ganglion has been done for over 100 years. If the medication used is intended to temporarily block function of the sphenopalatine ganglion, this is called a sphenopalatine ganglion block.
Okay, so what are the reasons people end up needing the sphenopalatine ganglion nerve block?
So sphenopalatine ganglion block has a time-tested efficacy when it comes to serious chronic and episodic migraines, as well as trigeminal neuralgia, other trigeminal-associated cephalagias like headaches and atypical facial pain syndromes. It could also be used for maxillary root canal pain, for post-concussive headaches, sometimes even in patients that have hyperemesis gravidarum in the first trimester of pregnancy. We could also use a sphenopalatine ganglion block.
Now, in your practice, what types of conditions do you treat most often with a sphenopalatine ganglion nerve block?
Most often with sphenopalatine ganglion block, I've been seeing patients with chronic and episodic migraines. More rarely, we see patients coming in with trigeminal neuralgia, patients with cluster headaches, medication overuse to other types of headaches, and we're starting to see more patients with hyperemesis gravidarum. But I'd say migraines is definitely the most common.
Okay, and so what are, I guess, the current or more traditional treatments for migraines?
Right now, there's no real good treatment for migraines. I mean, sometimes these patients they're on an average of about 5.7 different medications. So they're on a variety of different medications from, ibuprofen to different types of anti-seizure medications to a whole variety of different medications to try and control the migraines, and a lot of these patients are suffering. Nothing really seems to help them that much to control the migraine.
So what are the benefits of a sphenopalatine nerve block over the traditional migraine treatments that you just described to us?
So, some of the benefits are that it's quick, it's effective, and it's relatively low cost. Currently, there's very little to offer the chronic headache patient. There's about nearly 2/3 of patients that are on these medications discontinue the medications because they're not really even working. So basically, the SPG block, or the sphenopalatine ganglion block, achieves neuromodulation of the sphenopalatine ganglion complex. This means that the time-tested efficacy of the procedure has been shown to have both immediate and sustained results. So they're typically sustained by interrupting the chaotic signals that are associated with these migraines. And although it's very effective, there's very few physicians that offer the SPG block because traditional procedures are uncomfortable for the patients and demanding for the caregiver. Traditionally, they would either do the block by navigating a cotton tip applicator through the nasal passage, or actually sometimes with a long needle through the side of the head. So those approaches have a lot of risks and sometimes require sedation. But today, doing an SPG block has really never been easier. So what I use is the SphenoCath, which offers me the ability to offer first-line treatment to the chronic headache patient. So we use the catheter to deliver medication that can sustain pain relief in about a 15-minute procedure that is comfortable and quick. It can be done without needles, without cotton swabs, without sprays or systemic narcotics.
So can you actually describe to me when the patient comes in to get the block, how the procedure goes down step by step?
Sure. So SPG block works by we use a CT scanner to guide it, and we use a very low dose, like a pediatric dose of radiation, basically to guide the catheter, not really to do anything diagnostic. And then we place the catheter through. We anesthetize the whole area. We place the catheter through the nose, and using CT guidance, we can direct it directly where the sphenopalatine ganglion is, and we give a very quick shot of lidocaine to achieve the sphenopalatine ganglion block. And a lot of times patients will come in with headaches and the headache will immediately go away.
I'm making some very happy patients, I'm sure.
Yeah, very. Somebody took me to lunch the other week.
Yeah, I can imagine the relief after all those years of struggle.
Yeah.
So what are the risks of a block?
The risks of a sphenopalatine block are, very little. It could be irritation to the nasal cavity or the mucosa. You could have mild nasal bleeding, mild pain, but really very low risk procedure.
So the method you just described to us, I would imagine is your preferred method, and you alluded to some of the older methods. Could you just run through what some of those older methods of administering the block are?
So older methods include going through one of the foramens here underneath the cheek and guiding the needle into the sphenopalatine ganglion, which, as you can imagine, had its own associated risks and part of the time didn't even work. They would also sometimes use a cotton tip applicator, but the applicator wouldn't get directly into the ganglion, so that wasn't as successful either. So the newer method with the catheter and the imaging guidance is really been shown to be very beneficial.
So how does a patient, I guess, decide if a sphenopalatine ganglion block is the right thing for them to try?
So yeah, I mean, a lot of the times the patients that I'm getting that come in that decide that the sphenopalatine ganglion block is the right thing for them to try have tried pretty much everything. They're on, every single medication you can imagine. Some of these medications are expensive. They're suffering. It's really hard to go to work. They have headaches 2-3 times a day, and it's really debilitating for them. They have no other options, and the sphenopalatine ganglion block has really been great for these patients.
So what makes you uniquely qualified to perform this procedure for patients?
So, as a radiologist, I have a very intimate understanding of the human anatomy. I've studied anatomy from head to toe. I know the head and neck anatomy very well. That allows me to know how to guide the catheter directly into the appropriate position. And as an interventional radiologist, I have the added benefit of doing many catheter-based procedures. So for me, placing the catheter directly in the sphenopalatine ganglion is almost like second nature.
Yeah, so how well does the block work?
So sphenopalatine ganglion block, about 75% of patients will have immediate pain relief. The remaining 20% have pain reduction at least greater than 50%, and only about 6% of patients will get about no relief. The long-term relief, 80% of patients have long-term relief from about 4 weeks to 10 months. So, it's a fantastic procedure with great efficacy. Okay, great. Thank you.
Okay, well, have a good Friday and happy Halloween.
Thank you.